let's go ahead and get started. Guys, so
Yeah.
we're thinking we're probably going to go about an hour. We tend to talk a lot, so there's always a chance it'll be more. This is going to be recorded, so I think that Hatch will send you the Zoom recording if you need. And just to give you a little bit of idea about the flow, I'm going to give you a little introduction to Jenny and I and our tribe and what we do and why we like to do this. And then Jenny's going to talk a little bit about what her concerns were since she just had her baby 7 months ago now.
5.
5. Why am I saying 7? Because I'm thinking we're in July and my brain isn't working. So 5 months ago. And I was there, so I should remember. And then we're going to use Jenny's experience and concerns as a launching pad to address a bunch of the questions that you guys brought up with with Hatch. And then we'll finish with how Jenny feels after the delivery, like what happened in her immediate postpartum, during the hospital, what happens to your body, things like that. So it's a lot to cover. We clearly cannot be comprehensive about everything, but I think these are good, important nuggets about how to approach it and how to view it. So I'm Shiva Gofrani. I'm an OBGYN for 22 years, and this is Jenny Hayes Edwards, and we became business partners and fast friends. Now it's been almost 2 years because in the fall of 2019, we collaborated. Jenny came to me and said, I'm going to have a baby with my frozen embryos from a frozen egg from a decade prior, even though she looks divinely young. She's actually now, she was 45, she birthed 46 now. And she wanted me to help herald her through her delivery. And we decided that we were going to build a platform that we have now built called Tribe Called V, whose purpose is really, like we say, to increase your knowledge, to decrease your anxiety, because we want women to understand things happen to all of us. Birthing and pregnancy and getting pregnant and all the aftermath can be so anxiety provoking. But if we all work together, we can have great outcomes despite things happening along the road of these outcomes. So our platform really is meant to educate. So now we have a pregnancy program. You guys can go to tribecalledv.com and learn about it, where we do 2 Zooms a month. We have a great ebook that we've written that's like 200 pages of just preemptive knowledge that helps decrease your anxiety. And I think that like now I've had several of not only my patients, but women throughout the country who have delivered and given us their details. And I've just heard my own patients, the amount of knowledge they've gotten from us really has helped them, even when they've had challenging deliveries, C-sections, postpartum issues. They really feel like the knowledge they've gotten in a way that, again, decreases anxiety has been really helpful. So that's what we want to try to achieve tonight, but we only have an hour to do it. So without further ado, I'm going to let Miss Jenny tell us, as she was going into her pregnancy, like what were her concerns. And just to give you a quick background, she froze her eggs. She got pregnant with a frozen embryo. We have it all documented. It was very fun. And we've actually been building our pregnancy course that will be out at some point soon. But tonight we were really going to talk about pregnancy itself as opposed to getting pregnant, which is a whole nother can of worms. So without further ado, go ahead and tell us your concerns and like what you thought was going to happen. And then we'll talk about what really. Yeah.
Well, it's interesting sort of having a baby on the later side, because I have the blessing and the curse of maybe, 20 years of war stories from family and friends and, all the different experiences that they had during labor. And so through the years, I mean, I didn't even know if I was going to have a baby, but I did at age 45. And leading up to the labor, I mean, everyone can say like, don't stress, don't worry, don't panic. It doesn't do you any good. But it's, as a human being, as a female, I think it's impossible to not worry. And I don't want to say panic, but kind of build up in your head, what's going to happen? How's my body going to handle it? What are the things that are going to go well or not go so well? Is my plan going to happen as I hope? All those things. And so I think it's so normal to have all those concerns. And the goal is to just not let your mind run away with the stress and the concerns, and to be pragmatic and thoughtful and know that it's all going to work out. It always will. It's going to work out. So just go in with that attitude. Yeah. And it may not. In fact, it most likely won't happen just as you plan. As Shiva and I have a whole section in our book about birth plans. But having the right attitude, knowing that you're in collaboration with your doctor and that you guys as a team are going to, your medical team is going to do the best they possibly can, and they have your best interest in mind. So just have faith in that, and trust. But But interestingly for me, as I said, I was 45, I'm 46 now. I have a little 5-month-old little girl. But I was 45, going into this labor process. So I don't consider myself old, but I'm not a spring chicken either. So I was a little nervous. How's my body going to respond? And that I'd say the things that were the biggest concerns to me were the epidural. How's that going to go? I hate being numb. I hate like when my arm falls asleep. And so I was really nervous about the experience of being numb. So that was one huge concern. I was nervous about the epidural itself, getting it. I was nervous about the various drugs that you might be given, that I get nauseous really easily. So I was worried about getting sick. I was very worried about tearing and an episiotomy. I mean, what female is not going to be worried about that? That is a scary concept to think about things, going awry down there. I was sort of worried about, I was worried about breastfeeding. We're not going to go into that on this particular call, but those were the big ones. And then of course, my goal was to have a vaginal birth, but Shiva and I had long talks about the whole idea that, we're going to go in with the hopes that I could do a vaginal birth, but know that if it came to it, that we might have to switch gears. And I had an open mind with that no matter what happened, it was going to be a beautiful experience. And I think that truly, truly is why everything worked out so nicely, because I said to my husband, I said, no matter what, yes, I do want a vaginal birth, but no matter what, it's going to be a beautiful experience. And I'm so grateful that I get to go through this, period, having waited so long to go through it. So, so those are my big concerns, and the experience as we will go through, and I know a lot of people submitted some questions, and a lot of the questions were things that were my fears as well. And we're going to sort of go through them methodically, and feel free to put more questions in the chat as well, especially if we're not touching on things that you really want to get to. But I'm excited to help you guys know that even with all the fears, I was a scheduled induction. So I didn't just go into natural labor. For a variety of reasons, we scheduled me to be induced 1 week prior to my due date. But what's interesting about knowing the date that you're going in is that, the night before and the morning of, it's like I knew it was happening that day. And I actually filmed a video of myself because I was so emotional. I mean, absolutely just crying, scared tears, happy tears, just so emotional going into that day. So I just understand that it is a really, really, really emotional experience, for good, for not for bad, but for your nerves, your worries, your excitement, all the things. So, but just rest assured that it's awesome. Even when it's not perfect, it's awesome. And that's really what you're going to remember. I mean, you're not going to remember the little things that just weren't perfect or didn't go exactly as you planned. So, so that's sort of a general overview. And Shiva, do you think it makes sense that we can go into into the different bullet points and then go into a little more detail?
Well, okay. So first of all, I love that you guys are writing some questions and comments, and we will get to those. Like, I think at the end, we'll try to leave some time for questions. And I'll try to address all of these things, because I know a couple people, someone's getting induced on Wednesday. Good job. I mean, I don't mean good job, like great, because you're having a baby. Good job to be induced or not, or have a C-section or not. We'll address all these things. Anyone who's on this panel who knows me knows I say this all the time, and Jenny knows I say this all the time. The most important thing to me as a doctor and a woman is that I want good communication. And like Jenny has said, I love collaboration. So while we're saying this will be a great outcome and you'll be okay no matter what, and it'll be beautiful no matter what, the honest answer is it can be beautiful. It can work out. It can all be great. But it means you have to try to really feel that you are collaborating with your doctor or midwife. And that means not going in with a list of what you want to happen, because we don't know that we all get what we want exactly, right? Other than we want to be happy, healthy, and end up having a baby one way or the other. And I would say, as the doctor, I don't say to you guys, like, it's going to be this way. I want us to collaborate so that we both feel good about the experience. And if we do both feel good, then it will be beautiful. whether it's vaginal or C-section, it won't matter. It will be beautiful because we'll both feel authentically, collaboratively heard, and as if there's no reason other than this is what had to happen, but we've come to that conclusion together. Jenny also knows, as anyone who's on here knows me, that I try not to use and I try to dissuade the use of the word fear because, like she touched upon, of course, you're all nervous. You're pregnant. It's like the most nerve-wracking thing. I've had 9 pregnancies and 3 children and both kinds of deliveries. And I was still nervous despite having done this myself as a doctor every day because you don't know how it's going to go. And you don't know if you're going to feel pain or be excited or be sad or be emotional or if you're going to deliver vaginally or all the things you don't know. But fear, as I always say, is something that should be reserved for when you're getting chased in the wild. So I really urge and offer and beg you to not enter into this with fear. And if you think you're feeling fear, try to reiterate to yourself, they are actually just really anxious and nervous. And that's different than being scared because scared implies something bad is going to happen. And the truth is, while things might happen that are not our plan, we as doctors and you as patients can collaboratively work together to get a good end result. So that's just like my mindset nugget that I will literally try to keep reiterating over and over because that is the difference between how people really do well or not. Some people just spontaneously walk in, plop out a baby. It's great. I love those people. They're easy. But most of us, that doesn't happen. And if we don't walk in, it was not for Jenny, it was not for me. I would say it's not for most of my patients, especially with their first. But if we walk into it with a healthy attitude of, I'm nervous because this is new. I don't know how it's going to go. My doctor doesn't exactly know how it's going to go, but she and I are going to work together, then you're going to have a good outcome. And I guess I would say this, if you don't think you have that relationship with your doctor or practice, then you should find a practice where you do, because they exist. I know tons of practices that operate that way. And so you can find them. Okay, so let's launch into concretes, right? First of all, we're going to talk briefly about C-section versus vaginal because some people had questions about C-section versus vaginal. Many of you might be induced like Jenny or like Tara who's on our call, or Kristen who's questioning being induced. And there's various medical reasons you might need to be induced. For example, if you have high blood pressure, if you have diabetes, there's reasons you might. Sometimes you might electively choose to be induced. There is data now that being induced at 39 weeks as opposed to 41 weeks might improve the vaginal delivery rate. So that's a conversation you should have with your doctor because it's opposed to our old data that said wait until 41 weeks before you induce. So whether or not you get induced or have a C-section, it's still good to go into it knowing that you're not exactly sure how it's going to turn out. If you get induced, you still might end up with a C-section. So let's just quickly talk about C-section stuff as if it was elective, because I want to focus a little bit more on the people who are trying vaginally, because I think that's the majority of the people here. If you go in for a C-section, you still can have a very beautifully engaged experience because your doctor can still do stuff that's pretty standard in many hospitals nowadays. Delayed cord clamping is pretty standard in most American hospitals, meaning the baby's born, and as long as the baby is showing a sign the baby is vigorous, we will not cut the cord immediately. So you do not need to put that on your birth plan most of the time because it's pretty standard. Ask your doctor if it's something you want to make sure it's something the hospital does. But delayed cord clamping, we try to do skin to skin even in the operating room. It doesn't always work out because you might be tired or nauseated, and just logistically having a baby on your chest when you have a drape here for the operating room is not always so easy, but we try to do skin to skin. And if not in the OR, when you go to the recovery room, which is usually within an hour or two, we standardly, and I think many hospitals now, do delayed bathing. So the baby will not get a bath for the first 24 hours. And that's kind of a big buzz word that's happening in the world of the microbiome and in a lot of like midwife blogs and doula blogs, but that's something many hospitals standardly do. So that can all happen even with a C-section. And frankly, some of us feel like I felt better after my C-sections than my vaginal delivery, though many women feel better after vaginal delivery versus their C-section. So everyone is different. Don't go into it assuming because it's a C-section, it must be worse or it must be a harder recovery, because it's not necessarily. And then what happens when you go into the operating room, someone had asked specifically, is you go in, you get your spinal if you're having a planned C-section where you get one shot, then you lay down. The whole procedure takes about 25 minutes to 45 minutes. You will feel touch and pressure, but no pain. Hopefully you and your doctor will be chatting the whole time. And then once you're all sewn up, you go into the recovery room. I like to say it like that because that's really what's going to happen. During that period of time, other things might transpire, but it can be as kind of direct as that and as beautiful and engaged as long as you talk to your doctor about it. And your doctor can certainly hold up the baby and show you the baby, and you might feel more lucid than if you had a really long vaginal delivery. So again, don't set yourself up for disappointment. Know that you can have a great delivery, even if it's a C-section, because they're both great in different ways. As far as some of the things you can do towards the middle to end of the pregnancy to help get your body a little bit more ready, there's not great data, but there's some interesting data that I usually tell patients if they want to start around 35 weeks, if they're interested in anything kind of holistic, dates, so eating 5 to 6 dates has been studied in the Middle East to help thin out the cervix. So 5 to 6 dates a day starting at 35 weeks. And perineal massage, which we're not going to go into detail about right now. You can certainly, I don't love Dr. Google, but Google it because they will describe how to do it. But perineal massage twice a week for just 5 minutes has been shown to help thin out the perineum and stretch it out a little bit so that you're less likely to tear, since I know that's a big concern for a lot of people during this call. So those two simple things that kind of help you feel like you're getting a little bit more control out of a situation that feels out of control. What you can do to help your body go into labor, if your body is getting ready to go into labor, you can try anything that helps you poop, which is why you hear people talk about castor oil, enemas. Some people say spicy food, but that's only if it helps you poop. And semen. So pooping and semen both release prostaglandin, and that can help put you into labor if your body is getting ready to go into labor. Like if you're going to go into labor in a day or two, then those little bits of prostaglandin, which is the hormone that we give you to put you into labor, that might push you into labor. So those are some things you can do beforehand to just get your body ready. When you get to the hospital, most likely what's going to happen is the doctor or the nurse or the resident or the midwife or the PA, these are the different people who you might experience. They will examine you. They'll see how far dilated you are. If you're in early labor, they might check you a couple hours later. And if you're too early, they might send you home. And if you're progressed enough, they will keep you for being in labor. Then you get to choose between whether or not you want to have any pain medication. I think it's incredibly noble to go into it saying, I'm not going to have anything. But I encourage my patients to stay open-minded and say, I don't know how I'm going to feel. If I have enough pain, I might take pain medication. I would personally encourage people to have an epidural if they want a little bit more calmness during their labor, but some women are able to, through hypnobirthing or just on their own, get through things very calmly. So you really need to decide on your own, but I would encourage you to not promise yourself that you're not going to get pain medicine, because it's hard. Once you're in labor, sometimes you have a lot of pain, more than you thought you would experience. And even those of us who have a high pain threshold, labor is really different and it can be long. So there should not be any disappointment. Everyone gets a medal regardless of how they deliver and whether or not they are anesthetized or have pain medicine. You have the option during labor of getting often an IV pain medicine, like either morphine or Demerol. So those are narcotics. And those can kind of help take the edge off and just make you sleepy in between contractions without completely taking away the pain. The upside being some patients would rather do that early on in labor or avoid an epidural altogether. The downside is if you get that, you do not get up and walk around. Like once you have morphine or Demerol or any kind of narcotic, you cannot get up and walk around because it's not safe. You might pass out, so you're not going to be able to do that. If you're lying in bed, we're going to talk a little bit about the peanut ball and stuff that Jenny had done. So I'm going to touch on that about after we talk about the epidural, because your other choice is you get an epidural. An epidural is a procedure that's very safe in America. The data shows that like 90-something% of women will get an epidural. The likelihood of something really dangerous like an infection or, God forbid, paralysis is incredibly small. I mean, literally a tiny, tiny number. So you get a little tiny catheter, a skinny little like plastic tube that gets put into your back, and it bathes those nerves with constant anesthetic so that you feel numb from the waist down from a pain perspective, but ideally your motor function still works. So you're able to a degree, move your legs. Sometimes you can't move them very well and the nurses have to move them. And to a degree, you're still able to push and feel pressure. So the ideal epidural is, I don't have pain, but I feel pressure. So then I'm able to push. Many women, even without feeling that pressure, get guided by their nurses or midwives or doctors as to how to push, and they get the hang of it and they're able to do it. So I don't want you worrying that, because I think there's a lot of lore out there like, oh, well, my epidural was too heavy and I couldn't push. That can happen sometimes. And then we sometimes dial back the epidural a little bit so you feel more pressure. But most women are able to deliver vaginally even with their epidural. Now, once you are in labor and you are unable to move, either through morphine or an epidural, or even if you are able to move, the nurses will encourage you to be in different positions. And many nurses nowadays throughout the country are doing a lot of things that midwives used to do. So many of the nurses are being trained on all these interesting positions that I joke are like the Urban Dictionary. Like they will literally put you in crazy positions. There's one called flying cowgirl. There's one called fire hydrant. Jenny, you were in a bunch of them with these different balls. They look like yoga balls. It'll be a round ball. It'll be a peanut shaped ball, different sizes. They might have you sitting up. And these positions are all meant to get your body and your pelvis to change so that that baby can traverse his or her head down into the pelvis and come out. So I always joke it's like the puzzle that someone will have on their coffee table where it's like a metal puzzle and it's like two horseshoes with a ring and you have to try to figure out how to like get the ring off and you don't know what you're doing and all of a sudden it comes apart. And that's almost what it's like. Like the baby has to get into the right position. And sometimes just subtle changes in your position that kind of open up your pelvis will really allow that baby's head to get into the right space. Whereas in the past, I mean, even up until 3 to 5 years ago, we were just laying the women in their bed and at most flipping them from side to side. So labor, even in a hospital where everyone is groomed to believe that we just want to intervene and do C-sections, which is not true, labor has come a long way and we've learned a lot from nature. We've learned a lot in the medical community from our doula and midwife counterparts about how we can help aid this to be as, I don't like the word natural, but as vaginal as is possible. And when it's not possible, then we have the alternative, thank God, because that's how we should look at it. No one should have a C-section unless they need it. By the way, I would personally say should have a C-section because they need it includes if you want it, then you need it because you have reasons. So I do not think it's wrong for people to choose C-sections because in my mind, they need it for different reasons. And that doesn't mean they're weak. It doesn't mean they have any problem. It means for their particular case and circumstance and their body and their baby, they needed a C-section. C-sections have an amazing place in the medical community, thank God, because in the natural world, it didn't, babies didn't always come out. But I also want you guys to know that throughout America right now, hospitals are making big strides to improve outcomes with vaginal deliveries. So I think it's really important to know that so you don't feel that you're being kind of tied to one or the other.
Shiva, can I jump in real quickly?
Yeah, I was going to say, I want you to now talk about your labor and some of the things that could happen and did happen. And I want to just touch upon also like the baby's heart rate dropping after an epidural and during labor, because that's something that makes people really nervous.
I was taking a couple notes. I wanted to go back just to touch on just two things really that you said before. The perineal massage. I personally, this is slightly uncomfortable for some people to talk about, but
not us.
We ended up, not us. We are open books. I did this with my husband and I encourage that you do it with a partner only because if you have a partner, because when you do it yourself, you may not be as likely to kind of get in there and make it a little more uncomfortable, meaning the idea is to use some form of an edible oil, so like an olive oil or a coconut oil, some sort of oil that you can ingest, that's safe to ingest. And if you go onto YouTube, you will see there are plenty of instructional videos, but the idea is to really kind of start stretching the skin. And if you're comfortable doing this with your partner, we joke because your partner, if they're going to be involved, is going to see a lot. So it's almost a little lead up. But I found it to be really, really helpful. We did it, I think 3 times a week for the few weeks leading up. And I found it to be helpful because it really, I don't know, kind of got that skin nice and prepped. Yeah. So, and someone says, is perineal massage done at 35 weeks to like the dates? Yeah. Yes. So they say like about 4 or 5 weeks prior to your due date, you can start doing it 2 times, 3 times a week. They say that anything
5
more
minutes at a time.
Yeah, and they say any more than that doesn't really have benefit from what they found. So we did it. I recommend it. It can be a little awkward, but I thought it was a good thing.
But I agree with Jenny. I mean, I think that the data is unclear as to whether or not it really stretches things out in a way that decreases your tearing or episiotomy, though anecdotally it probably does. But to Jenny's point, it also it helps you connect maybe with your partner, or if you're doing it on your own, it helps you understand your body more and connect more. And I think the more we feel like comfortable with ourselves and our body, the less fear, the less scared, and maybe the less controlling we will need to be about the things we can't control, because we realize there's certain things we can control. I can control my perineal massage, but I can't exactly control if it tears or stretches, but I'll do the part that I can do. Right. So it's, to
Mhm.
me,
Yep.
outside of the physical aspect, it's the mindset aspect that it's helping you.
Yeah.
So
So I just wanted to mention that really quickly. And then in terms of let's just hop into, so as I mentioned, I was induced. So I went in on a Tuesday evening, ultimately had the baby on Wednesday evening. It was kind of a long, almost 24 hours. But one of the things I want to jump in real quickly that I sort of wish that I had known, is when, if you are being induced or in the initial stages of labor, for me, I was in a lot of discomfort, but throughout the evening, like meaning, let's call it 10 p.m. to 4 a.m. in that like 6 hour window. But it was so early that I was too, no, I'm not sure if afraid was the right word, but I was like, okay, I'm in a lot of pain. I can't sleep at all. All the lights are out. Everyone's like asleep. My husband's asleep. The lights are out. The nurses come in to check your heart rate every 30 minutes or something. But I could not sleep at all because I had enough discomfort. But I was like, oh my God, I'm only a few hours in. How could I possibly be in this much pain already? It's too soon, right? I've got to endure this. I've got to endure this because it's too soon. Well, the nurse kept saying, are you sure you don't want a little morphine? And my concern is that a lot of people, morphine makes them nauseous. And I was like, I don't want to be nauseous. I don't want to be throwing up. And so then she finally said to me, because I didn't actually say that out loud, and I finally did say that out loud. She's like, well, the morphine is administered with an anti-nausea. And I was like, oh, interesting, because I didn't sleep at all until 4 a.m. Then at 4 a.m., I was like, okay, I have to get some rest or I'm going to be in big trouble. She gave me the morphine and I was out from 4 to 8 a.m. until Shiva and all the doctors started coming in to like really start administering the Pitocin and all the various things that get the induction really going. So I just say that because I wished I had done the morphine a little earlier just to have gotten sleep. Because once I did, it was like, okay, now I can at least close my eyes for a little bit and try to sleep. So that was one thing I wanted to throw out there. Do you have anything to add to that, Shiva?
no, but actually some of the people have had some questions about epidurals. So I'll, just so everyone knows, I'll answer all of your guys' questions after if they're not answered during this. Yeah, go ahead. And
Okay,
actually,
so then the next
it's
thing,
such a good example
oh,
though, that like the nurse presumes you guys will tell her if you're worried about nausea, and that if something happens, she's going to help you. Like if you're nauseated, I'm going to help you. But this is a good example of like, if you're worried about something, you guys, it's good to voice it, right? I mean, without
yeah,
being like, I'm worried about like the speck of dust on the ceiling, but like if you're worried that the
right.
morphine is going to cause nausea, then tell them, because then they'll explain to you like, we'll give you nausea medication preemptively or after you feel it.
Yeah. Yeah, and I didn't get sick from the morphine. So then we're going to sort of fly through the morning. If you are induced, there's a series of steps. We won't go into all the details, but there's a series of steps that occur, and basically the contractions start picking up in intensity and speed and all that kind of stuff throughout the day or throughout however long the period is for you. For me, I went in saying I'd like to go as long as I can until you just know. Everyone says you'll just know if you're choosing to do an epidural. I'm gonna speak from that perspective since I did an epidural and I knew I was probably going to. I wanted to experience contractions and labor as long as I could. I wanted to feel it. I wanted to go through it. I don't know if that makes me a glutton for punishment, but I really did. I wanted to feel it, and then I just knew that I would know when I was ready. And so I did kind of like pretty intense contractions. And mine were a little faster than average. I think they were coming like every 2 to 3 minutes pretty quickly. And one of the issues that Shiva will go into is that my little baby, her heart rate was going down a little bit every single time I was having a contraction, which was fairly often. So we had that concern going on there. But for a good 2 to 3 hours, I mean, I knew I was in labor, like I couldn't form a sentence, when the contractions were coming. So I knew that it was there, but I was only at 4 centimeters and I stayed at 4 centimeters for a while. Then we got to about noon, and that was the point when I was like, okay, I'm ready. I'm ready for the epidural. Now, what was interesting is somebody wrote in their comments that they're more afraid of the epidural than labor itself. I was you. I was more afraid of some of these other things than the labor itself. So once I said, okay, I'm ready for the epidural, the anesthesiologist came in. The trickiest part is that you have to sit still for the 10 minutes, 15 minutes that it takes. But to be honest, ladies, you are so looking forward to relief that you figure out how to stay still. I went through 3 contractions during the epidural. She was there. She was holding my hand. We have pictures because you have to get over into a C-like position. Your back, you curve your back. But I'm telling you, your brain, you are women, we are so strong, and you go to a different place and you figure out how to be so freaking still because you're so looking forward to the relief. Now, here's what I'll say that is to me so funny. My husband was really into watching the monitor, which would tell me when I had a contraction. He didn't have to tell me before I had the epidural. Obviously, I knew, I was feeling it all. And then I had probably 2 or 3 more contractions before the epidural kicked in, because it's about 10 minutes or so. They say about 10, 15 minutes before it kicks in. And then all of a sudden I was laying on the bed and my husband's like, you know, you're having a contraction right now. And I was like, I am? No way. And it was like this beautiful, like, this is great. I am fine. We're going to have a baby, you know, and 10 minutes prior, I couldn't even form a sentence. So during the contraction, of course, you get the relief between, but just to give you a sense, that's how it worked for me. And it was funny that I was so worried about the epidural because, you know, even though I couldn't feel my legs, it's really funny because your legs will sort of flop, but the nurses are right there. And the nurses are so amazing. And like Shiva said, they really are so good at what they do, and they do it all day, every day. And they're so kind and fun. If you make it fun, I was trying to sort of make everyone laugh, and it made the experience fun. And then unfortunately, you know, I stayed 4 centimeters contracted for quite some time, to the point that Shiva came in and she said to me, you know, okay, we're going to give it 1 more hour. She was a little worried about the fact that the baby's heart rate was, you know, kind of all over the place. And she said, I'm going to give you 1 more hour. And if nothing changes in the next hour, I think we might have to switch gears, which I think was great because it gave me some time to kind of say like, all right, maybe we're going to have to switch to a C-section. And in that 1 hour, I went from 4 centimeters to 10 centimeters, unbeknownst to me, by the way. I just laid there in bed. I was super calm. I manifested. I just was thinking very positively. I said, no matter what, it's all going to be okay. And then she came back an hour later and she went down there and was like, oh my goodness, here we go. Mm-hmm. So it was kind of a funny little change of events. Now, from that point of 10 centimeters, I did push for 3 hours. We're going to go into that in a second. Do you want to touch on any more epidural stuff before we jump ahead?
Some good questions here about epidurals. So can you receive pain medicine through your IV and have an epidural? Absolutely. Yes. Great question. Most people, if they're going to use IV pain medicine, they use in the early part of labor. Like Jenny said, either like during the induction part, if you get induced with prostaglandins before the Pitocin while you're kind of just crampy and restless, or maybe even trying to sleep because it'll help with the pain and help you sleep. Or they want to do it in the early part of the labor until they get a little bit more active, meaning there's an old-fashioned dictum that you should wait till 3 to 4 centimeters before getting your epidural until you're in more active labor. Most doctors do not stick with that anymore, but some of my patients, would rather wait until they feel them, like Jenny said, more regularly than just those really intense early crampy pain. Now, some patients will have every 1 to 2 minute contractions and they're only 1 centimeter. And in fact, many of us will say, if it's been this long, can you please get your epidural? Because once you get it and then you relax, we sometimes see patients suddenly dilate a lot, which it kind of is what happened with Jenny. Mm-hmm. Kind of. So yes, you can get your IV pain medicine and then get your epidural. That's one question. There was a question about a walking epidural. Someone said, my hospital doesn't offer walking epidurals. How do I ask for an epidural that isn't too heavy? Here's the good or bad news. Very few hospitals offer walking epidurals anymore. I mean, in other words, walking epidurals were, from what I understand of it, because our hospital has never in 22 years offered it, but what it seems to be is hospitals that are incredibly busy, that don't necessarily know that they're going to have all the anesthesiologists available kind of at regular intervals when you need them, will sometimes place the catheter and the epidural before it's fully dosed. so that you literally could walk around as if you're not in labor, but you have the catheter. And then once you need it, then the nurses or the anesthesiologist will push the actual medicine through the catheter. The whole notion that it's like just a light epidural where you can walk around. I mean, it's like one of those urban legends, I think. Like, I've never met anyone who's had one, and I've never met current doctors in any hospital in America where they offer them. Because imagine if you're partially anesthetized, because it's, again, local anesthesia and sometimes morphine that's causing the pain control, then it would be dangerous for you to get up and walk around.
Mhm.
So just from a liability perspective, I don't think any hospital will even allow it. So don't worry that your hospital doesn't allow it. It's very common. You can certainly say to the doctor, like, I'd like it to be lighter, but the honest answer is the doctor is going to give you a dose kind of based on your weight a little bit and your height more than anything else. And if it feels too heavy, then they can dial back, like I said, a little bit
Mhm.
so that you feel a little bit more. Everyone's anatomy is different. So your nerve endings might absorb more of the medication, less of the medication, more side, one side versus the other. So I really do want to kind of, I'd never want to say anything that's going to make everyone anxious and nervous, but I also want to be honest that some patients, like one of my patients 2 weeks ago, needed to get 2 epidurals because her epidural just didn't really work as well as it could have based on certain anatomical differences in her spine. If you have a little bit of scoliosis, she happened to have had spinal meningitis when she was younger. There are different reasons outside of just like the doctor didn't do it correctly, where you're not as anesthetized as you would like to be, and then the doctor can come in and give you more of the medicine through the catheter or redo it if they need to. So the good news is it'll likely work one way or the other, but it might take a couple of tries. And yes, you can get the IV pain medicine and then the epidural. Another thing that's common that happens during labor that I'd rather you guys all preemptively hear now so you don't freak out if it happens is the side effect of the epidural and the spinal, which is what you would get if you're having a C-section right off the bat, is that your blood pressure drops. When your blood pressure drops, that means that the uterus transiently misses out on some of that blood supply, and then the baby's heart rate will transiently drop. So not only will you sometimes feel lousy and kind of dizzy and crappy and nauseated after the epidural, that you're often not that upset because like it's better than the pain you had. I used to joke like I would take a needle in my eye given how much pain I had, right? So you might feel nauseated or dizzy just right after your epidural, but your baby's heart rate might drop. And it sometimes drops pretty quickly and pretty deeply to the point where not only does your nurse run in, but your nurse and 3 doctors and 5 other people come in and they flip you around. And it can feel very anxiety provoking in that moment because the nurses are trying to get the baby's heart rate to come back up while the doctor's examining you. Sometimes they have to give you certain kinds of medication to bring up your blood pressure. In those moments, what I hear patients say afterwards are things like, they lost the baby's heart rate. It's not that they've lost the baby's heart rate, it's that the baby's heart rate can drop. And if we don't hear it really well, we will sometimes put special monitors to hear the baby's heart rate well. So instead of the external monitor, we will sometimes put a little wire, believe it or not, that attaches to just the scalp, just the skin, that gives us a much more accurate reading of the baby's heart rate. And that can really help us. So it's very common in labors for the baby's heart rate to drop after the epidural in response to your blood pressure dropping. So again, if that happens, I just want you to think, okay, I've heard about this before. Most of the time, after several minutes, the heart rate will come up. If it's past a certain number of minutes, and I can't say exactly what minutes because it kind of depends on a few factors, but once you get past like 5, 6, 10 minutes of the baby's heart rate being down, then we do start to kind of say, listen, if the baby's heart rate doesn't come back up, we might need to do a C-section pretty quickly. Your doctors and nurses are used to doing this a lot. It doesn't mean they don't take it seriously, and it doesn't mean they don't have an adrenaline rush, but I don't want you to think that they are scared if they're acting swiftly and concisely. But again, if you know that now, if it happens to you, because it's very common, I don't want you guys to freak out. I want you to just try to reflect and think this is going to be okay. The heart rate's going to come up and then I'm going to be fine. Or if it doesn't, they sometimes will have to do a C-section. It's not a significant enough issue that I would ever dissuade someone from having an epidural, just to be really clear.
Right.
Okay.
And mine did go down. And it was, yeah, I wasn't feeling so hot for a little while there, but
Yeah.
then everything kind of comes back.
And actually, let's just tie that back into the shaky. Someone had said she heard a lot of people get C-sections and then become shaky. How true is that? What can be done to make it smooth? So the shakiness that women will experience after the baby comes out has nothing to do with C-section or vaginal delivery, epidural or not. I see it with women who come in rapid labor, fully dilated. I barely make it into the room they delivered, they will shake. Women who've had long labors that end in a C-section will shake. Women who have delivered vaginally with or without an epidural will shake. So it's actually just the release of certain hormones causes us to feel a shaking, and it's not that you're cold, it's just that you're shaky. It doesn't happen to everyone, but it happens to a lot of people. So the honest answer is there's really nothing you can do about it other than anticipating that if it happens, there's nothing bad about it, there's nothing dangerous, it's fairly short-lived, it'll usually stop within an hour, maximum 2. And the one thing to try not to do is like grip yourself against it, because then you end up getting achy in your muscles afterwards. But it's a common misconception that it's C-sections, and it's not. We see it just as frequently in those rapid, fast vaginal deliveries. Okay. Okay. Go ahead with the rest of your little baby's heart rate going down.
So, well, one other little thing I was going to add, and we do in our, and she was in my pregnancy program. We have a couple different videos that we have filmed about this, but I did a video about sort of all the things that I thought I was going to need or want in the hospital that I didn't even touch. I mean, it's funny. You just have this like vision of what's going to happen. And like, I thought I was going to walk around a lot, and you I don't know, at least for me, I was just very comfortable in the bed, not really moving and just being told what to do. And so, which leads me to my next thing, which, you know, Shiva touched on, which is the nurses. You know, feel free to encourage your nurse too, to get you into different positions if she thinks it's going to help. We had one of my nurses was so great. She was into all these different positions. And at one point I was on one side and both knees were sort of in. So one leg was way up, and it just shifted my pelvis open in a way that really kind of moved things along. Now, you can't do any of that on your own. I mean, they're holding you because you cannot lift your leg. But it's kind of amazing. Like, I loved just laying there and letting them kind of just do all the things and let them do what they know how to do, and try to let my body be super calm and do what it needs to do. So then, we have a friend. But the next thing too, which, by the way, you know, if you guys have other questions about what to pack and all that stuff, we do, Shiva and I do have some interesting resources there, so we can share that later. But so now I'm in the I'm fully dilated, and Shiva everyone's ready, you know, like, okay, you're fully dilated. Long story short, I did end up pushing for 3 full hours. So I think it was about 4 o'clock. I was fully dilated, and I had the baby at 7:15 or so. So it was a lot of pushing, which, going into our next section of our talk, created some havoc on my body. Now, the pushing itself, as Shiva said, I found that to be not as challenging as maybe I'd worked it up in my head, because I had the epidural. I used as soon as I started using the bars on the side of the bed, I really use that for leverage. They are guiding you and giving you direction of exactly how and when to push. And so that part, I just sort of did what I needed to do. But in the process, it was taking so long that towards the end, let's say, I don't know, maybe a half hour prior to my baby being born, Shiva kind of comes up to me in her sweet little nice way, and she says, okay, so the baby keeps kind of coming out and then coming back in a little bit. It's like, and that happens, I think, for every birth. She's like, if we do a very small episiotomy, she will probably be out in the next push. And we were now getting close to 3 hours of pushing. And of course, every woman's fear is, you know, the episiotomy. And she looked at me and she said, don't worry, it's going to be fine, but she'll be out in the next push if we do this. And I looked at her and I said, I trust you, do what you need to do. So we had a small episiotomy. And, you know, my feeling on it is that at the time I was like, oh, you know, I'd rather a controlled cut than an uncontrolled tear. And if they feel that this is what needs to happen to get her out, let's just do it. It's going to be okay. My body will heal. And so we did it. Of course, I didn't feel a thing. And then she came out, not the next push, but the push after that. And it just, like, after that, of course, you forget everything, because it's just like this whirlwind of activity, and it's just so amazing. And then they're doing all this stuff down there. And I have literally no memory of the placenta being born, zero, no memory of it at all. And because you've got like a team down there and they're just doing their thing, and you're so wrapped up in baby, and it's like, it's crazy what you don't know is happening down in your body. So that's the parting message I want to give. I mean, we're not parting quite yet, but one of the messages I hope really resonates is that all the things that you're thinking about and you're worried about, yes, some of those things are going to happen. I mean, I had an episiotomy and I was worried about it, but I'm telling you, ladies, like in the moment, it just wasn't a thing. You're so excited and you're so thinking about what's about to happen and meeting your baby. And oh my God, I get emotional just like thinking about it right now. It's like, it is so exciting. It's so exciting. And you're just not going to be worried about that tear or that episiotomy when it's happening, because you're going to be so excited to meet your little baby. I can't believe I'm getting emotional right now, but it's true. It's been 5 months, 2 days ago on the 10th, but it's just don't, I mean, I know everyone's going to worry. It's impossible not to, but try not to, because it really is amazing with the way the maternal love will just take over. And that's why women have 2, 3, 4 more babies. I'm not, because I'm old, but why a lot of women do it, because it's just like, it's so amazing. So do you want to, now that we've talked, do you want to talk about some episiotomies and tearings?
And I just want to reiterate what Jenny said. I think that you won't think about it as much in that moment, but the truth is, I think you won't focus or think about the things that you didn't want to happen if you go into it again with the right mindset. Because I have had patients who years later are like, I never wanted that C-section. I never that C-section. I still think about it every day. And the God's honest truth is, there's nothing different between that patient and everyone else. That patient is just as healthy. That baby is just as healthy. That patient chose to continue to, no matter how much I tried to collaborate with some of those patients. Now, sometimes it's because you don't feel validated and heard and collaborated with. And that's a sign that you should be with a different doctor. Sometimes, I'm telling you, I talk a lot for everyone who knows me. I really try to collaborate as much as I can. And some patients really want to focus on all the things that happened that they didn't want to happen. And I think we've made it clear that I really would urge all of you, I mean, forgetting in labor, I would say this in life, use this as an allegory for life. Try not to focus on all the things you don't want to happen. And when you do try to focus on what you want to happen, have it be kind of like a fuzzy general. Like, what we want is you and the baby happy, healthy. All the other things would be great. Like, I'd love to order up a great vaginal delivery with, not too long pushing, no tear or small tear. Like, I'd love that. Selfishly, as the doctor, it would make my life better. None of the doctors want to do C-sections. We don't get paid better for it. It's longer for us to have to see you guys afterwards, but we just can't always achieve that. But we can make you feel validated and heard if we collaborate together. So again, that I'm going to keep saying it because it's so important. Now, with regard to concrete, so I really want us to discuss two things that I think are really common misconceptions. One is, I don't want an episiotomy because it's going to be a harder recovery. That's not the right answer. The reason you don't want an episiotomy, that you might not even realize, is that the data shows that if you cut an episiotomy, like if this is your vagina and your perineum's here, and you cut an episiotomy, then where you've cut is more likely to further tear as the head comes out, and it can further tear into the rectum or the muscle right above the rectum. That's a 3rd or 4th degree tear. The muscle is a 3rd degree, the rectum is 4th degree. And you don't want that. That you do not want. What you want is for your pushing to not be held back that much longer by your perineum. And you ideally want to recover well. So that's where you really need to trust your doctor, that in that moment, he or she needs to be able to make that decision. Like Jenny had pushed for 3 long hours. The baby's head was crowning for a while. And we could tell with how taut her perineum still was, despite doing perineal massage and despite 3 hours, that if we didn't give her some space, it would probably take her another 20 to 40 minutes of pushing, which, given the baby's heart rate and how long she'd pushed, was not something that we felt comfortable with. And that she might have torn, if this is your vagina, higher up, like close to her urethra, places that are harder to control. So in that moment, we had to make that kind of game day decision, I call it. Our episiotomy rates for most doctors in America right now are well under 10%, like well under 5%. We just don't cut episiotomies often, but when we need to, we need to. So again, I urge you not to go into it saying, I don't want an episiotomy. What you mean, I hope, is I don't want an episiotomy unless I need it, which, by the way, your doctor, unless she's like 90 years old, should not be cutting an episiotomy unless you need it, because the data has clearly shown that for at least the last 2 decades. If you don't have an episiotomy, let's say we let Jenny push for 40 more minutes, her recovery, I guarantee, would have been even harder than her episiotomy, because the amount of swelling after that almost 4 hours of pushing would have been harder to recuperate from. So whether you get cut or tear, the recuperation is going to be the recuperation. You don't want, like I said, a tear into a third or fourth degree if you can avoid it, because that is more uncomfortable. That's one. The second thing was I wanted to just really quickly, because we can't talk about operative vaginal deliveries, meaning vacuums and forceps. There's so much that we could discuss that, again, we talk about in our pregnancy programs a lot. But vacuums, I just heard someone say this to me at a dinner party the other night. My wife didn't want a vacuum because she knows that the vacuum causes a cone head. And that is not true. The vacuum is not going to cause your cone head. Your cone head being caused by the fact, one of the other things I wanted to touch upon, you might end up having what's called back labor, where the baby's head is down, but the face is sunny side up. Instead of looking towards your spine, the face is looking upwards towards the sky. And that can lead to really intense back labor where you feel tons of pressure on your sacrum. And that can mean that the head diameter that's trying to come out of your pelvis is bigger than the diameter if the baby were looking towards your spine. That can lead to the baby getting a cone head, because the baby's head is meant to be able to wedge itself into your pelvis and mold itself to your pelvis to come out. So those babies who are sunny side up, who take longer to push, will potentially need a vacuum to help the baby come out, but the vacuum is not causing the cone head. The vacuum might cause a little ring around the head that's transient and going to go away, as is the cone head. That'll go away within, a day or two. But these are the things that keep getting perpetuated and then lead to a lot of anxiety. Like, I don't want to vacuum because of the cone head. The cone head is going to happen. You can ask all your friends who've had C-sections that push for 2 or 3 hours. Those babies come out with a cone head without the vacuum. So that's just another little thing to debunk that I really want patients to realize and know.
We talk about recovery, post body.
Yes.
Afterwards.
Let's talk about a little bit about your perineum post body, but I just want to address a couple of these questions too, as we are getting closer, because we could talk for hours. Someone has low amniotic fluid. What are some suggestions to help from being induced medically? Well, this person is 40 weeks. Her amniotic fluid is 5.5. Amniotic fluid gets measured in vertical pockets, and 5 to 25 is considered normal. So technically you're normal, but you're on the lower end of normal. So I would say if the baby is moving and they are putting you in monitoring or testing, where they're either looking with an ultrasound or putting you on the fetal monitor, and they're showing that the baby is okay, you don't have to be induced. Though again, really good data, the ARRIVE trial, it's called, hundreds, or I should say tens of thousands of women were evaluated, that getting induced at 39 weeks might lead to more chance of vaginal delivery. The concern is you're already 40 weeks with low fluid. If you wait till 41 weeks where your fluid is lower, then labor might cause more heart rate decelerations, which might prompt a C-section. So you might be better off getting induced on the earlier side than later. I say might because it's a conversation to have with your doctor. There was another question. Oh, and about inductions, by the way. Did we talk about this, Jenny, before you did it? Because I know we talked about it in our program. When people are going to get induced or when they're going to have a C-section, I try to encourage not eating the big fat carby meal the night that you're going for the induction, which is what I did when I was getting induced, because it was 17 years ago. And I was like, I'm gonna eat my spaghetti carbonara. Then I got induced, and that did not go well 2 days later after I delivered, when I was all constipated. So I urge you guys who are getting induced, there's the inclination is, let me eat my last meal now because I can't eat at the hospital. First of all, again, most hospitals will let you drink all the clear liquids you want, meaning water, broth, Gatorade, bring anything fancy you want, because all they usually have is broth and juice. But I would actually try to eat a big breakfast, maybe if you're getting induced at night, but then maybe a lot of soups and smoothies and shakes, and then try to poop, because whether or not you have a C-section, you end up getting constipated, and that is just uncomfortable. And then really quick before you talk about, there's a question about the Foley catheter and about forceps. So I'm not going to touch on forceps just because I don't do forceps. Many people don't do them anymore. Some people do. There's nothing wrong with them in the right hands. They're not easy to do, so they have to be done well and in the right patient. I personally don't like forceps, so I chose never to do them, because I find that the force you have to use is a lot more than the vacuum. You can deliver babies easier with forceps than a vacuum. There are certain babies I will not be able to deliver with just a vacuum, but in my estimation, as a female and as a doctor, those babies that need the force of a forcep, I would personally rather have do a C-section, because there's a lot of pressure on mom's pelvis and on her entire pelvic floor. And I don't personally believe that the damage to the pelvic floor is worth it, because that's long-term. So that's not the right answer for everyone, and some you should talk about with your doctor, okay? And then Foley balloon. So as far as inductions, you might have oral medication, vaginal medication that help soften your cervix and get you to have some contractions, and then a Foley catheter, which is a little balloon that goes up into your uterus, to your cervix. Actually, ours is called a Cook balloon. Foley is what we put into your bladder, but some hospitals use that, and it just stretches out your cervix and releases the same hormone called prostaglandin that can help soften your cervix. It's pretty crampy for many people. Jenny, you had the Cook. Didn't you have the balloon or no?
Yeah.
Yeah. And it actually, you didn't think it was
Yes,
as
I did.
crampy as we thought. And then you can talk about your perineal recovery. And the answer is yes, you can take Colace the day of induction. Someone had a question about taking Colace, which is a stool softener. Hell yeah. Take all the stool softener.
Buy a bottle now.
Wait, and before Jenny takes over, because this is important, you are probably going to poop when you push, and that's okay. Your doctor, your nurse, your midwife, nobody cares. The only people in that room who care are you, because you're thinking about it, and I urge you not to think about it. In fact, I have said often, if you poop, it means you're pushing in the right way, and we're not even going to talk about it if you poop. Like when patients ask me afterwards, I'm like, I literally do not remember who pooped and who didn't. I would never remember. It's like saying, did you have amniotic fluid? My assumption is you pooped, because my assumption is you pushed, and when you pushed, something was going to come out. So if you poop, I swear on everything I love and own, your practitioners do not care. In fact, they will applaud you if they even talk about it, because it means you're pushing in the right way. The only person who might care in that room, like I said, is you, and maybe your partner if he or she is grossed out by other people's poop. But they have to deal with it. Like, they're lucky they're not the ones pushing out a human, right? Okay.
Right.
Recovery, and then you guys ask any last minute questions so that we can get you guys off by about 8:30.
Yeah. So I think, again, I kept thinking about, oh gosh, what is it? What is my body going to feel like, look like, all the things afterwards? And, what's the word I'm looking for? It's amazing what your body does. And so you have to give yourself some grace, right? Because I'll tell you, so the nurses in the hospital are the maternity nurses. So now you shift up to the maternity ward. The labor and delivery nurses are amazing. They do what they do. And then you've got the set of nurses that are going to be with you for the next couple of days while you're in the hospital. And they're so good. And they know what they're doing too, because they do this all day, every day. Just use them, listen to them, take their advice, ask questions. Because what's interesting is that you're going to be, they come into your room like every hour, 24 hours. Like you never, they're constantly coming in, monitoring your vitals and all that kind of stuff, but they're also giving you all the stuff that you need. So the ice packs, the cooling pads, the Colace, all the stuff that you need. I was thinking that I needed to have so much stuff, but they really give you everything that you need, the squirt bottles, all the stuff. And the first night, because I gave birth at 7:15 p.m. So when I'm being brought up to the room, it's like nighttime and it's late, and it felt a little weird, a little lonely almost, because you're in this hospital room and you're like, oh my God, what has happened? But the nurses are going to be your best shoulder to lean on, literally, because you're gonna need their help to go to the bathroom, or your partner's help. But just those first couple of days are a little hard, because it's a little hard to walk and do all the normal things, especially if you're like a doer and you don't really love asking for help. But your body heals it's impressive what your body can do. The one thing I was not totally prepared for in my mind were the hemorrhoids. And I pushed for 3 hours. So I got plenty of them. And they're not that fun. They really aren't that fun. But my biggest suggestion is that you have supplies at home for that, so that you're ready. And the hospital is going to give you a lot of stuff. I recommend, as I said, I kind of shoved a whole bunch of the supplies in my suitcase and said to the nurse that I was out, so that she resupplied me like 3 times. So that by the time I went home, I had so much stuff. But the ice packs they give you are amazing. And I just sort of kept with that process of using the disposable mesh underwear stuff that they give you, the ice packs, the little cooling pads with the witch hazel that are great for hemorrhoids, and the squirt bottle, that sort of whole thing, and the Colace. All of that, you're going to get really good at it within 24 hours. You're going to really understand how to take care of yourself and all the things you need to do. I left a big, huge bag right next to my toilet in my bathroom so that I had everything super accessible. So it wasn't hard to deal once I got home. And I would say within about, Shiva, what would you say? About a week is when you don't need as much padding. And then after about 2 weeks, you're kind of down to basic padding. And then you're kind of just dealing with like, just like normal healing. Your body's going to feel different down there for sure. But it was not, it goes so quickly. It goes so quickly because you're so focused on the baby and not really on yourself. But it was not that bad. I'm not going to say that it was a breeze. It's that, I mean, your body has to heal, but it was not that bad.
Well, so. and I'm going to add to that this. I think the honest answer, and I don't mean honest, like Jenny's being honest because hers was not that bad, right? Like my vaginal delivery was actually a really hard recovery, which is why I chose to have C-sections afterwards. Now, I still say at the end of the day, when I say really hard recovery, in the end, I was okay. So I want you guys all to just remind yourselves, like you might feel great right away. You might feel lousy right away. Your friends might have had the most easy delivery and easy nursing and all that stuff, and you might not. But if you communicate and keep your wits about you, you will ultimately be okay. And that ultimately might be a day, a week, a couple of weeks. Like my recovery from my vaginal delivery was far more challenging than Jenny's. And yet, again, I still went back and had 2 kids. I just had them differently. And that was okay as well. So you can tell my constant theme to you guys is it will be okay, though none of this is probably going to be easy. But I don't want you to be scared going into it because that fear is only going to make every experience feel so much worse. Most of these experiences are going to be new and nerve-wracking, but they'll be okay. Tell me what else.
I was just going to add.
Yes, yeah.
Okay, I was just going to add one quick little funny thing. And you guys, I hope for all you ladies, for both C-section and vaginal births, the recovery process is different, but both are hard. But I will tell you, I was so nervous to take my first poop after I had had a baby. I think I was more nervous about that than labor, because your body has just gone through this whole thing. And so then the idea of pushing again is like, oh my God, and I remember being in the hospital and they prefer you to poop before you leave. They try to encourage you to.
Yeah, but you don't necessarily have to poop before you go, but you'll feel better.
No, they just, they like it. Yeah. They like it knowing that everything's kind of,
yeah.
Right. Yeah. So I did the Colace, I drank a lot of water. And then I tell you that because it's actually one of the harder things is not so much, it's actually sitting on the toilet that's very uncomfortable at first because everything's so swollen. But I was calm, I breathed, I sat there and I manifested the same way I did manifesting pushing the baby out. And I was able to go to the bathroom. And I think after I got that one, I'm sorry, it's a little graphic, but once you get that one out, then your body relaxes and you're like, okay, I can do this. It's going to be okay. But I'm going to say it because I hope I make you laugh when you are actually in that moment, worried about it. Just remember me and remember that it's okay. It's going to be okay. Just breathe.
I wanted to say, I'm going to try to do 3 more brief things and then we will finish. So one is there's a bunch of more questions and I wish we could get to all of them. And I'm not just saying this, sorry, I have like dog hair on me. But so many of these questions are things we address in our pregnancy program. So whether or not you're due soon, if you're planning to have another baby, we have really all of this information because these are all the questions I've seen for 22 years that we tried to distill down. But I want to address a couple things. One, 10 days into you having had that baby, vaginally or C-section, there might be a moment where you're like, shut the fuck up. I'm pissed off and I'm tired. And why is this baby screaming and crying? And please do not feel guilty if you feel that. Most moms will have that millisecond moment. They don't want to voice it because they think that they're the only one who's hated on their baby. I acknowledge it to my sister who then was like, oh, we all feel that way. And I thought, how come no one tells us that? So I tell as many moms as I can remember to tell, please don't feel bad. The second thing is call your hospital if you don't know what stuff they have. Like our hospital happens to give you pads, mesh underwear that like are amazing, that you love, that you think are going to be gross, but you're going to go home with like 20 pairs of mesh underwear because you're going to steal them because you think they're so great after you use them. We have like the ice pads, we have the squirty bottles, but every hospital is different. Not every hospital
Mhm.
has all these things. So you could ask your doctor if they know, or call the maternity ward and ask them so that you know what you need to take home or what you need to stock at home. And on that, someone asked about a belly band. Like our hospital has belly bands, but they're huge. So I usually tell patients, ask them for it, but then you can order a belly band on Amazon. There's no particular brand that I think is great. I would order one that you can return if you don't like it. The belly band is really only meant to help you like engage your core muscles so that you sit up straight. It's not helping you shrink your uterus or anything like that. There's so much more to talk about, but we are
And
out.
by the way, I ordered a belly band and I never used it. Well, I tried to use it. I put it on once and I was so uncomfortable because your body, it's like, I couldn't add more discomfort to my body. So I ended up not using it.
Yeah.
Just like,
But listen, there's so much more to discuss. You guys, great questions. Thank you for joining us. We really appreciate it. What else?
and if you're, by the way, just to add, we have, if you're interested in learning more about what we do, as Shia said, Tribe Called V, TRIBE, called V as in vagina, .com. Yeah, it's right there on her back. And you can learn about what we have, but we go into all sorts of stuff. I do a whole thing on what to register for, what I've used, what I haven't used, a whole thing on what to pack, what not to pack for the hospital. And then we go into, like all nursing, tons of stuff. So if you're interested in learning about any of that,
tomorrow night's live Zoom, we do 2 live Zooms a month. Where it's not just like this, it's the 2 of us, but all the panelists, whoever shows up, anywhere from like 5 to 20 people show up, and the rest can watch it taped on Zoom. Tomorrow night is our infant CPR nurse who's going to be doing an hour-long infant CPR class. So that if you signed up before tomorrow night, you can be part of that. So
or shoot me an email, just Jenny@tribecalledv.com. If you're interested in, hopping on and seeing what the program's all about, shoot me an email and we'd love to have you guys join our tribe.
All right. Thank you all. And if you guys have any other questions, then you can always direct them to us at Tribe Called V. Okay. And good luck, you guys. You can all do well. And well just means you and the baby, happy and healthy, vaginal and C-section. They're both great. That is my lasting word. Okay.
Yes. And don't worry too much. Just know it's going to be okay.
And you'll sleep one day. Okay.